Say, what's holding you back from having a smile that you want to share? You know, when it comes to dental implants, there are a lot of myths floating around out there, everything from the pain or the time it takes or the cost. In today's Trusted Advisor segment, Dr. Wesley at Splent Dent Implant Center sets the record straight on those things and more.
When we look at the long-term effects of dental implants and how they can take care of patients, we're looking at there may be an initial outlay of dollars that cost traditionally more so than conventional dentistry. But dental implants are going to last 30, 40, 50, sometimes going on 60 years. So we push all of that cost over that many years of successful treatment, and it brings down that cost to a tremendous amount for the patients. Well, when implants are properly done, the implant itself is actually underneath the bone and the gum tissue. It's all in the crown or the bridge that sits on top of it, and because you can position that implant in a proper position, a lot of our restorations that we place in there, very rarely does anybody even know you've had any dental work done. It is that lifelike, and the new ceramics and materials that they came out with are very translucent, so they look a lot like natural teeth. So it's a very stable restoration as well as cosmetic. Dental implants in the beginning used to be kind of contraindicated for quite a few patients that had dental disease, but we found over the years that they're actually perfect for those patients with various dental diseases, as well as medical issues. Pretty much there is no limitation to who we can do an implant on, whether it's age or any medical condition. There are a lot of doctors that do implants. They'll either place them surgically or work on the implant and do the restorative work or the crown and bridge work on top. And even though there's no specific licensing or area of specialty of dental implants, you truly want to, like any profession, find out the experience of that dentist placing the implant or restoring it, and make sure that they have some years behind them and have worked with a case like yours. It's always good to get a second opinion. A lot of these procedures, when we place an implant, can be done very selectively and non-invasive procedure, which cuts down the recovery time. Usually a patient who has a dental implant placed is a day or two of recovery time. Some of our larger surgeries, maybe 4 to 7 days of recovery, and we control that through pain medications and anti-inflammatories. One of the myths with the consultation method is people have a fear in the beginning of that they're going to get the consult of doom, and that they're nervous about that and they don't want to hear the ultimate. We're here really just to, we're here at Splent Dent really to bring the information to the patient and give them choices. What we want to do most importantly is educate the patient on those choices so that they can make well-educated decisions. Smile is a very important thing for people socially, as well as using their mouth functionally to work with chewing up food and eating properly and a good diet. So the sooner we can get to a restoration and an implant placement, the better off that patient is. If we can establish good, healthy bone, and mostly the patient's bone. We have ways of grafting in new bone, but I would prefer to always place an implant into the patient's original bone if they have it, and we end up with a much more predictable result. So the sooner we address the issues, the better the outcome. Well, I have 33 years of implant work behind me, so 3 decades of work, and was taught by some of the original pioneers in implant dentistry. So it's nice to be one of the older guys in the system, but at the same time, it comes with a lot of years of experience. So regarding COVID, here's my advice on that issue is we would rather get to your dental issues sooner than later before they get even worse. Understand that we are within that 6 feet of distance. We do take all precautions. We wear our masks when needed. And we've always trained to be in our field or our industry. We've always trained to use universal precaution. We assume all patients have some type of an issue that could be passed either from the patient to another patient or from that patient to us. So we make sure we take care of that issue because unfortunately we are in an industry that gets close to the patient.
Located at 4489 Byron Center Avenue Southwest in Wyoming. To learn more, just give them a call at 616-512-1958 or visit them online.